Hey everybody, this is Dr. Paul Thomas with Plum Health DPC, and today I'm talking about important screening tests for women. What is your definition of health? I think this is a great place to start because health can mean different things to different people. According to the World Health Organization, the definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And you can expand that to one step further, meaning like being healthy enough to engage in meaningful work that is fulfilling, that brings you joy and happiness. But we can stick to the WHO definition. And on the right side of the screen, I want to show that there are so many layers to personal health. They start with you, your body, your mind, your spirit, and then your family, the psychosocial environment, the physical environment, and then how you take care of yourself, like personal behaviors and human biology. And all of that adds up to your lifestyle. And then within that, you have a community and a human-made environment. Like, what's your infrastructure like? What's the environment like around you? And then there's also the surrounding culture and even the biosphere. So there are so many factors at play when we talk about our individual health. From a more public health perspective, there are policies and programs that attribute to your health factors that lead to health outcomes. So for example, there's a physical environment, there's the air and water quality, there's housing, there's transit. Can you get to and from work safely? Can you get to the grocery store and home safely? That's the physical environment. Can you make it to the doctor safely? And is it easy to get to the doctor on transit? Or do you have to have access to a car to drive to the doctor? That can be a barrier for some people who are low income. Building on that, there's the social and economic factors: education, employment, income, family and social support, and then community safety. So all of these combine together to play a big part in your overall health. And then above that is clinical care. So do you have access to care, and is the care that you're receiving of high quality? And then there are health behaviors. Do you smoke cigarettes? Are you exercising regularly? Are you eating healthy foods? Is your food free from preservatives or microplastics or environmental toxins? And then, are you limiting your alcohol and drug use? Are you practicing safe sex practices? And all of those things lead to your health outcomes, your length of life, and your quality of life. So, there's an idea in doctor lingo or in healthcare lingo. There's a lifespan and also a health span. So as you may know, Americans live on average 78 years of life, but the health span, according to some studies, is 65 years or 63 years or 67 years. So you may live to be 78, but are you healthy for all 78 of those years? And that's a really important question. And unfortunately, from 1990 to 2021, the lifespan is increasing slightly, but the health span decreased slightly. So people are living 12 years in infirmity or not with their full health. And that can be problematic. So how do we increase our lifespan, and how do we increase our health span? This is like a pop quiz that I want to throw at you. Can you name the number one cause of death in adult women? And that number one cause of death is heart disease. So cardiovascular disease is the leading cause of death in women. 30% of deaths overall are caused by cardiovascular disease, with high blood pressure being the number one risk factor for cardiovascular disease in women worldwide. And 14 times as many women die from cardiovascular disease than of breast cancer per year. So this is something that we may not think about, but men die of heart attacks and strokes, and women die of heart attacks and strokes. And the leading cause of death in women is heart attack and stroke. So when you have a heart attack as a woman, the symptoms can be atypical. In addition to having chest pain, women are more likely to have shortness of breath or nausea and vomiting or back pain or jaw pain. So if something doesn't feel right, you should call the doctor or go to the emergency department depending on the severity of the symptoms. So the top 10 leading causes of death in the United States in 2021 was heart disease being number one, cancer being number two, and within cancer, the most common cancers are breast, lung, colon, ovarian, etc. Accidents and injuries, that'd be like a car accident or drowning or a fall. And then you have strokes, chronic lower respiratory disease, Alzheimer's disease, diabetes, chronic liver disease, and kidney disease. So how can you be proactive about safeguarding your health? And this is a good women's screening checklist. I got this from Baton Rouge General Hospital in Louisiana. I just like the color scheme. I like how they broke it down by age, and I like some of the symbols and images that they use. But all women 21 to 65 should be getting a pap smear every 3 to 5 years. Everybody should be checking their blood sugar and getting their cholesterol screened and checking their thyroid health. Once you turn 40, it's important to get a mammogram, usually annually, and it's from age 40 to age 75. If you have a higher risk factor, like if your mom or your sister had breast cancer at a young age, you'd want to screen earlier. And then women should get a colonoscopy every 10 years, usually beginning at age 45. If there's polyps or concerning features, the GI doctor or gastroenterologist may have you come back for a screening every 5 years or every 3 years or every year, depending on the severity. As you age in your 50s and 60s, you should be checking your bone density, looking for osteoporosis or osteopenia. If you have risk factors for heart disease, maybe you do a coronary artery calcium screening. If you are a heavy smoker, maybe you get a CT scan of your lungs. Every woman should get a screening of their skin to rule out melanoma or search out for skin cancers. And of course, checking your eyes and ears every year or two is a good idea as well. Many women don't know that there is a vaccine that can prevent cancer. And can you name that vaccine? And of course, it's the HPV vaccine. So HPV vaccine usually started around age 9 or 10 or 12 or 13 in girls, or given to young women as well. Prevents 90% of HPV strains that cause cervical cancer. The HPV vaccine blocks 90% of HPV strains that cause anal cancer, and the HPV vaccine blocks 90% of HPV strains that cause genital warts. So this is a great vaccine. If you're a woman of any age, really, you can get the HPV vaccine, but it's most effective the younger you take it. So that's why it's mostly recommended in girls like 9 or 13 years of age. Or if you have a young woman who's had one partner or a few partners, you can get the HPV vaccine to prevent strains from future partners. This is a lot of data to go through, but this is best discussed with your family physician. But this is the vaccine table. There's several vaccines that you can take to prevent influenza or RSV or tetanus, or if you're a new mom or pregnant woman, you want to get the acellular pertussis vaccine to prevent your baby from getting pertussis. Measles, mumps, and rubella vaccine is also available, as measles is unfortunately making a comeback at this time. And then if you're traveling abroad, you would want to get your hepatitis A vaccine. And there are several other vaccines that you can receive. It's a lot of information. It's a lot to discuss in 5 or 10 minutes. And the best way to have a comprehensive approach to this is to discuss it with your family physician, a trusted family doctor and trusted internal medicine doctor. If you have a great relationship with your OBGYN, obstetrics, or gynecologist, they could also address these issues for you as well. Thank you so much for watching, and have a great day. Again, this is Dr. Paul Thomas with Plum Health DPC. Take care.